Welcome back, everyone. Welcome to Day as a Professional. And today I'm here with Mrs. Kristina Kutter, a person who is currently working in the public health field. How are you doing, Mrs. Kutter?
I'm doing great, thank you.
And thank you for taking the time out your day to come and talk to me on my channel. And yeah, let's get straight into it. My first question for you is, what initially made you get interested in the field of public health?
Well, I had been working in the environmental field, working in hazardous waste remediation and cleanup of hazardous waste sites, and realized that I wanted to do something that was related to public health. That was because that is public health, but I wanted to do something that was more involved with people. So I decided after 10 years of doing environmental work to switch to kind of more maternal and child health side of public health and went back to school and got my master's in public health.
Mm-hmm. And what would you say some experiences you had in when you were on the environmental side, how
Mhm.
they've helped you in the public sector, in the public health sector?
The environmental health work that I did was very helpful because what I was doing at that time was like I said, working on hazardous waste assessment and remediation. So we would go to a site and try to figure out what kind of hazardous waste is there and what should we do to kind of clean this up so that the site can be used for something else. And so a lot of the skills that I learned there, problem solving skills and how to approach, how do you approach that? How do you approach a site and look at what you know and try to figure out how am I going to investigate this? So being able to come up with a plan of action, being able to come up with a plan to implement that plan of action, and then be able to report back on your results. So a lot of that was directly translatable to working in more of the maternal and child health side where I'm working now on different public health programs.
Mm-hmm. And if you could give us an example of a place or an event where you did the planning and then you did implement the planning you had done, which then resulted in a positive outcome, both in when you were in the environmental business as well as when you're now in the public health sector.
Oh, sure. Well, in the environmental health arena, I worked with a team who was working to do hazardous waste assessment and remediation at a large military facility. So I was part of a team, and one of the projects that we worked on there was a specific location at this site, going in and doing sampling to soil sampling to figure out what contaminants were in the soil, and then ultimately investigating and implementing a solution to clean up the hazardous waste material in the soil. So that was really exciting to be able to actually see it through to the part where okay, now we're gonna try to fix this problem or try to clean it up.
Mm-hmm.
Um, and much more recently, in my current role, I work as a health services administrator for a local public health department. And several years ago, I launched our first school-based dental clinics. So it was a lot of planning with our different partners to figure out how we were going to do that, which sites we were going to work at, and then figuring out what's all the equipment that we're going to need and what are all the pieces that need to fall into place for us to actually start providing a dental clinic in a local high school.
Mm-hmm.
And so we had a dentist and a registered dental assistant, and we're able to start the clinic at one high school, and then we expanded to four. And then the next piece of that extension that I worked on was writing a grant to get two mobile dental clinics, these big RV buses that
Mm-hmm.
have a dental clinic inside. Now we take that around to different schools.
So they kind of just drive around different schools. So if somebody has a dental problem, they're like,
Hmm.
call up the dental bus. And they come and do the business.
Exactly. Well, yeah. Well, we have set locations that we go to, and people can call and make an appointment.
Mm-hmm.
Yeah, so it's
Mm-hmm.
well received.
What would you say are some experiences which you had gained in college which currently help you in your field?
I'm sorry, experiences of,
Like experiences in the sense like technical and non-technical knowledge which are gained.
okay. I think my writing skills are a huge skill that I would say I learned early on in my career. And it was more technical writing, so writing reports and plans,
Mm-hmm.
but that forced me to learn to be very succinct in my writing and to be thoughtful and professional in my writing. And that was really helpful, has been helpful throughout my career. I mean, so much of our communication is through email, and being able to communicate with people in a clear and concise way, being able to write grant applications, also requires really strong writing skills. So I think that's one skill that I didn't realize how important that would be um, when I started.
Mm-hmm.
And I think in addition to that, critical thinking skills, like how do you approach a problem and try to figure out a solution,
Mm-hmm.
is a really important skill.
Mm-hmm. And how would you say, uh, okay, what would you say are some of the coursework you did take, like specific courses, which have helped currently in the public health field? And would you say that you would need like a lot of a lot of prior knowledge in the healthcare industry to become a healthcare administrator, or is it just like you need like a little bit of knowledge and you've taken some courses pertaining to the healthcare administration and business administration?
Well, I would say in terms of coursework, public health is huge. Public health encompasses, not just what we think of as, healthcare, but it also encompasses environmental health and infectious diseases and oral health.
Mm-hmm.
It's really huge. The different ways that people can have a career in public health. So it's incredibly diverse. So in terms of coursework and how that influences your career, I think that in part is dependent on what your interest is. So, if you're interested in, say, epidemiology, well, then probably coursework around statistics is really important. For me, a lot of the coursework that I found most useful and relevant when I was first starting my career was classes on program planning. So how do you plan a public health program? Classes on evaluation, on how to actually, how do you evaluate a public health program to see if it's having the impacts that you're looking for it to have. And then also just background classes that were around content knowledge, because when I came into my public health career, as I said, I came from environmental health, which is a form of public health, but I was switching to a different focus. So I needed to kind of widen my knowledge base
Mm-hmm.
about what are the things that impact health.
Right.
Um, yeah.
Mm-hmm. And you're currently in the public health sector. Specifically, you're currently in like childcare and child health and mother's health and father's health. So what do you say are some major problems which are currently in that particular area? So like you said that you'd open a dental clinic for high schoolers so that they can have proper oral hygiene. So like that, are there other problems that are prevalent in high schools which need to be how do you say, thought of or implemented?
Well, I can tell you what our programs are working on, which
Mm-hmm.
I think are relevant in a lot of communities. So I specifically work in school-based health. So we provide medical, dental, and mental health services in schools um, to elementary, middle, and high school students.
Mm-hmm.
And so I would say, mental health services all of those services are really important, and there's different aspects of them, and depending on the setting. So example, a lot of our high school sites, the primary services that we provide there are reproductive health services. So we provide confidential services to teens who are interested or who need those services.
Mm-hmm.
So being able to provide teens a place where they can go that's youth friendly and that's confidential to provide those services is, I think, really important. And not all communities have access to those services.
Right, right.
Um, yeah, and I think similar to dental and mental health services, they're not always so readily accessible to youth.
Mm-hmm.
So those are the key services that our program works on. And we work across, well, this is pre-COVID because now we don't, now we're not doing this. We're doing other things.
Mm-hmm.
That we were in over 30 schools providing different variations of those services.
Mm-hmm. And what did you say are some key interests which a person should have when they're going to school health, specifically when they're thinking of public health or public health in
Uh,
general?
Public health in general,
Mm-hmm.
um, key interests. Well, I think again, like public health is so huge. Some people come into it very specifically, like I'm interested in maternal and child health, or I'm interested in health education, or I'm interested in infectious diseases. So I think kind of being curious and figuring out what are the things that I'm interested in and taking the time to kind of learn about them. But also if you have access to look take classes that are beyond those interests
Mm-hmm.
within public health, I think that's really important to kind of understand the broader public health framework and what public health all entails because um, our health is so intertwined with other factors, where we live, where we work, how much money you may make, your education. And so, you know, looking at the broader public health world and understanding different impacts to health, I think will always serve you well.
Mm-hmm. And what would you say are some responsibilities that you hold on a day-to-day basis?
Well, right now, our operations, because again, I work for the public health department.
Mm-hmm.
So we are considered disaster service workers, and the pandemic is considered a disaster. So all of our operations in the program that I've been in have pretty much ceased. And we are fully dedicated to the COVID response, which has included um, testing for COVID, contact tracing and investigation, and now vaccines.
Mm-hmm.
So currently my focus is on helping to open new vaccine clinics and support them as they kind of get launched.
Mm-hmm.
And our newest piece is I'm working with school districts to identify locations where we can open up vaccine clinics in school and then helping to support those teams that are going to go in and operate in the different schools to provide vaccinations for students and their families.
Mm-hmm. Because it's very important to like get vaccinated so that we can have like some sort of immunity against the virus, and then we can
Right.
come back to some resemblance of life before COVID.
Yes.
I get
And
it.
we want to reduce the barriers. We don't want to make it hard for people to get it. So this is one
Right.
more place where it's available in your community.
Mm-hmm. It's just like easy. It's accessible. That's like comes down to accessibility for most people. Like if it's like an hour away from them, they're probably not gonna go get it just because they might not have the time or it's like really far out. If it's like right in the like 5 minutes away, they can like walk there, bike there, and then get the vaccine and go back
Right.
home. And my next question for you is like this is like a personal question just because I didn't understand like how contact tracing was done because I know like one person gets COVID and then the people around them get affected. But then how do you know like which people have come in contact with who? Because that person may have passed many different people on that day.
Right. That's a good question. So if once we know that someone has been diagnosed with COVID, our contact tracing and investigation teams, they reach out to patients and they'll say, and they'll have like a little mini interview with them and ask them, um, you know, when their symptoms started, if they had symptoms, and they try to kind of understand what's happening from that perspective, and then ask them, who have you been in contact with? So like, who do you live with?
Mm-hmm.
Have you been going to work? Did you go to work during this certain time period? So we try to understand when were they likely infectious, And when could they have passed, COVID to someone else, and who were they in contact with for a certain amount of time?
Mm-hmm.
And then we'll go and if they can identify, they might say, oh, I have three roommates and, I was hanging out with them before I realized I was positive. And then once I got my test,
Mm-hmm.
or test result, then I've been, isolating. And so then we'll go and then we'll talk to those three roommates and
Mm-hmm.
say, okay, you were exposed and you should get tested, and we give them guidance on what they should do then.
Mm-hmm. And if you could, I know you already gave me some of the things you're currently doing as a disaster management person in the public health sector. But otherwise, how would you say a normal day looks like from like when you come in or like when you log in to like when you leave?
It can really vary depending on what we're working on and what pieces I'm supporting. So I'm not personally in those school-based clinics.
Mm-hmm.
I am, as an administrator, I'm more back in our main office working on various projects to either, help support the teams of our staff who are out in the schools, or support the program in other ways. So we have, you know, not a lot of meetings, but we have, meetings to kind of make sure we're all on the same page, because it's a very large program. So we want to make sure that we're all working together. So we have, for example, someone who manages the health educators and someone who manages the nurses, and we all work together. Those staff all work together as a clinic team. So there's a lot of coordination that happens. So I work a lot with our other managers. I'm in a lot of contact with them. Um, and then also potentially what's happening, depending on what projects I'm working on, and I may be in contact with different school sites, or working on different initiatives to bring new services in or expand our program in different ways.
Mm-hmm. And if you could, like, tell me some challenges which you have faced since COVID has come. I mean, obviously, communication and talking in person has been a challenge just because getting hold of someone has become much harder just over email or text. But otherwise, how would you say are some other ways which you face challenges in helping being in the public health sector, being in school health and maternal health?
Um, Well, I think with COVID, just how we've had to pivot and change so quickly, from doing, all of our staff had to, these are people who were like, I'm a health educator in a high school setting, talking to youth about birth control or STDs
Mm-hmm.
and or whatever. And now you're in a testing site.
Mm-hmm.
So I think as a larger team, all of us have had to pivot our roles and, kind of take on different roles and responsibilities in order to create the services that we're creating. So I think in some ways that's been the biggest shift. And, things have, sometimes things change really quickly, and, we're doing one thing and then,
You shift to
okay, we're
another.
going to expand, or we're going to do this. And yeah, so being
Mm-hmm.
able to respond to those needs.
Mm-hmm. And like you were talking about before, how like a common misconception about the public health field is that it's just one area. It's like instead of just one area, it's like different facets, like environmental, there's school health, there's infectious disease. And what would you say some other misconceptions people have when they think about the public health field? And why would you say these misconceptions have arisen?
Well, I don't necessarily think that there's a lot of a lot of people going out there and saying like this is public health, because there's so many. I think there's so many facets of public health that the public doesn't kind of realize it. I think of often people, when people think about public health, they would think about their local public health department and the services they provide. So,
Mm-hmm.
maybe it's STD testing, or maybe it's restaurant inspections,
Mm-hmm.
or um, programs that have to do with maternal and child health or immunization. So, and public health is all of those things, but it also, depending on the setting and the organization, the mission, it can be so much wider than that.
Mm-hmm.
Um, so I think it's just kind of education and what the public's awareness is.
Right, right. And what would you say is your favorite part of the job?
For me, I think there's two things. One is the people that I work with. I feel super fortunate that the people that I work with are really motivated, dedicated, um, wonderful people to work with. And, it's a very supportive team and we have great leadership that makes a huge difference
Mm-hmm.
in my daily work. And then on top of that, I feel like I've been fortunate enough to stumble into um, a career because I didn't set out going to go into public health, but I found something that has been a really good fit with my values. And I've been able to land in a position where I am able to use my skills in a way that feels rewarding to me.
Mm-hmm.
So I would say that's the biggest part of it. So I feel very fortunate.
Mm-hmm. And would you say that as a healthcare administrator that you have to like constantly keep on learning in the sense like as new materials keep on coming out, like the new effects of the vaccine, new transmission, like new effects of the virus, new side effects of the vaccine, like do you have to keep on like reading up on it? And does that carry into your work-life balance in the sense that when you finish after your work day ends, you have to bring work home so that you have to finish it?
Um, I would say, with COVID and the time of COVID, because things are changing so much, we're learning, we didn't know so much when we were starting and we were building a lot of these programs from scratch. We didn't have a COVID testing before,
Mm-hmm.
so we had to build those and we didn't have these large vaccine sites. We've done immunizations before. So I would say definitely a lot of things changing and it was a lot of learning, understanding what is our state health department recommending, what is the CDC recommending. So a lot of learning around that. And, at times I have had to bring work home, but I feel like overall I have a pretty good work-life balance, which I
Mm-hmm.
appreciate.
Mm-hmm. Yeah, that's always great to have a good work-life balance because it's nice to have. That's all I can say. Really,
Yes.
I don't really work, so as soon as I do, I hope I do soon. But following to my next question, what are some ways high schools can gain more knowledge in the field in the sense like what courses can they take or what websites can they visit, what books should they read?
I would say if your school, offers courses in health or public health, you can take that. Read the news. I mean, especially now, there's so much information, right? About, I mean, not even just about COVID, but I think raised our awareness of a lot of health issues and, you know, being able to understand, I mean, how do the decisions that our governments make impact our health? How do the decisions that we make as, not just individuals, but state and local governments or policies? I mean, understanding how that works is something that I think we're seeing every day now in a way that I don't think people recognized before. So read and stay current on what's happening.
That actually gave me a really interesting question. How would you say government policy affects your job?
Um, well, certainly, like on the local level, in our health department, our health department is making decisions around how we're going to respond to the pandemic. And then, my program is having to implement a lot of those. So,
Mm-hmm.
we're taking direction from them as to, if they say, okay, we need to open up this many vaccine sites so that we can serve, our population. We're taking our direction from them. Um, I think that's probably um, the biggest way that it is manifesting right now. Pre-COVID, I think there was a lot more program ability at the program level for us to kind of direct what we were working on, as opposed to the health department saying, we need to work on this or we need to work on that. There was some of that, but there was also a lot of latitude within the different programs, whether it was a maternal and child health program or community health or whatever it was.
Mm-hmm. And So the skill set and the courses required for public health, can it be applied to other fields? And if so, what fields would they be?
Yeah, I believe that a lot of the programs, a lot of those could be applied. I mean, just thinking of, if we're talking really about like skill-based coursework,
Mm-hmm.
like program planning and evaluation, I think the skills that you learn in that are completely transferable. I mean, program planning is a lot about understanding, what is the issue that I'm trying to address and what's the best way to address that within, what's relevant to the community. Um, Thinking about how you would create something and bring in the people who are stakeholders and decision makers, and then, being able to implement something. That's those are really relevant skills, I would think, for a lot of different places and
Mm-hmm.
industries. And the same thing with evaluation, kind of thinking it's a lot about, like I said, for like, how do you approach a problem? How do you approach something that you're trying to address or solve?
Right, right.
Um,
Mm-hmm.
yeah.
And yeah, those are the questions I have for you today. Thank you so much for coming and talking to me on my channel. If you have any questions about being a healthcare administrator in the public health sector, please email me below. I'll leave my email down in the description. And yeah, see ya.
Great. Thank you.